for the dignity of a woman, you need more than just sanitary towels. A woman most likely would want to be seen as a clean person who carries herself with a good hygiene and self-esteem.
Kusema ukweli, magirls wanaumia huko nje. Naongea hivyo kwa sababu natoka ghetto, so naelewa hizi situations vile ziko.
With every pandemic, there are usually more challenges for the girl child, and COVID-19 is not different.
My name is Maureen Murenga. I'm the Executive Director of Lean On Me Foundation. Lean On Me started off as a support group of young women living with HIV, and we have since grown to an organization that has branches in Nairobi County, Kisumu County, and Siaya County. All our work is based on supporting access through advocacy and service delivery. And the kinds of services we provide are referral services, psychosocial support services, and preventive services for HIV and TB. In March, when we first started hearing cases of COVID-19 across the world, we thought it wouldn't come to Kenya. But eventually there was a first case in Kenya, and we did not know how bad the situation was going to be. But as we moved on around June, we started noticing that our girls were not accessing services because they had started putting measures to reduce the number of people who go to facilities. So our adolescents who need antiretroviral medication were unable to go to the facilities to get the medication. We also know that around March, schools were closed, and therefore it was difficult to actually support the girls that we were supporting through school-based program. We used to provide sanitary towels through the school-based programs, but now it was difficult because the schools were closed. It was also difficult to trace them because most of the schools we targeted were boarding schools, and now that they were scattered, it was really, really difficult to get them. That was compounded by the news we had from the media that there were lots of teenage pregnancies. And that one came home because some of the Lean On Me girls also got pregnant. And we knew we needed to do something. We thought of how we could support to actually reduce the vulnerability of the girls to COVID-19, plus other pandemics such as the teenage pregnancy, new HIV infections, and other sexual transmitted infections, including gender-based violence. And we decided to do a baseline survey and find out what are the challenges with the girls. So we identified peer educators, trained them on COVID-19, and sent them to the community. The aim was to identify the challenges that are there in the community. And over we heard about the issue of sanitary towels. We also heard about the issue of nutritional support. Many families had lost their household incomes, and they were going without 3 meals a day. It mostly was 1 meal a day and stuff like that. So we approached AIDS Healthcare Foundation, commonly known as AHF, and we asked for partnership because we had the resources, we had the girls, we had the human resource, but we didn't have financial resources to enable us carry out this project. The campaign that we are now calling Stay Walk on COVID-19 is actually meant to empower the girl in this season of COVID-19. Because of the many challenges that the girls are undergoing, we have seen that COVID-19 is creating many other little epidemics. We now have the epidemics of HIV because in one county, they said that almost half of the girls who are pregnant also had HIV. So COVID-19 is creating mini epidemics, and we want to ensure that our girls are not so disempowered that when these epidemics are passing, inapata tu ni yao. STI ikipita ni hao. HIV ikipita ni hao. Gender-based violence ikipita ni hao. So we are trying to avoid that and ensure that the girls are empowered enough to take care of themselves. We empower for self-care so that at the end of the day, they can make decisions from an informed point of view. If someone asks them for sex, they can think through and look at the pros and the cons of having that sexual relationship. If they feel they are in a place where they are not safe and there are opportunities for gender-based violence, they can seek for help because they will already know where to find help. And so this program is actually meant to reduce all those vulnerabilities that the girl is facing during this season of COVID-19.
Kusema ukweli, magirls wanaumia huko nje. Unapata demu unaenda kwa mamako kumwambia kusaidie do fulani, kitu kaa 50, ndio ili uende kwa shop upate sanitary towel, but unapata ni ngumu. Mzazi anakuambia sina hata hiyo 50 kwa sababu hata kupata chakula ya kila siku imekuwa ni ngumu sana. Unapata demu lazima aende kufua ndio apate do ya kununua pads. Lazima aende kufua ndio apate pesa ya kumpatia food. So sasa imekuwa hard, then unapata most people kama kwenda kufulia mtu, si mtu anakuamini ndio ingie umfulie, kwa sababu ukiingia unampelekea corona. So like kuna lack of information huko nje kwa sababu mtu anaona msemo mwenye anatoka ghetto akienda kwa nyumba ya mtu tajiri kumfulia, huyo wa ghetto ndo ako na corona, so anamletea corona kwake. So kuna hiyo discrimination hapo. So unapata madem kuna vile tunasafa. Naongea hivyo kwa sababu natoka ghetto, so naelewa hizi situations vile ziko.
We don't really have a lot of women coming up to talk about how this COVID-19 is affecting the girl child. They're just always talking about how to prevent it in a general way. They don't talk about how it affects the teenagers.
Through the support of AIDS Healthcare Foundation, we have been able to train 10 peer educators who are going to the community, reaching out to their peers to support them. And part of the support includes giving information on sexual and reproductive health so that the girls are able to make a choice. And they can make simple choices like, for example, if I had sex today, what are the repercussions? The repercussions would be I would get pregnant, I would get sexual transmitted infections, I would get HIV, but is it worth the kind of sexual relationship I have had? Is it a price worth paying for? The world has tried to demystify COVID-19, but we haven't seen, it was something new, so we were learning in the process. But right now we have quite some concrete facts on COVID-19, and therefore we are able to sensitize, our peer educators are able to sensitize their peers on what COVID-19 is, what it is not, how to prevent, and this information is also important to destigmatize COVID-19. There's a lot of stigma around COVID-19, and if we can learn from the HIV response, stigma prevents us from accessing services. We want people to be diagnosed with COVID-19 and treated in a timely manner that doesn't drive to loss of lives.
Unapata kwa slums, si kila mtu ako na TV, si kila mtu ako na radio, na si kila mtu ako na smartphone. So si kila mtu anapata hiyo information. Unapata in the slums, most people hawaamini COVID-19 exist. Na wanasema tena, in the slums, watu wa slums hawezi pata corona. Watu wa matajiri ndio wenye wanapata corona. Based on this project, tuta help so many young people by spreading the message, also by distributing the girl child's needs, and I know that tutafikisha target ya kuhelp most young girls, na by helping one girl tutakuwa tumehelp 100 girls.
And finally, in their day-to-day outreaches, they'll find those that need referrals for gender-based violence cases, or for treatment of sexually transmitted infection, for nutritional support, or for even HIV diagnosis. They will make referrals. We have already told them how to make referrals and to ensure that they support the girls to get those services that they need, that we as Lean On Me are not able to provide.
Like, this girl is empowered, she has been empowered. Then when she's empowered, she's passing the empowerment to another person. We want our young girls to be very empowered so that they can be able to make informed decisions in their life. And when they do that, the world will be a better place for everyone.
For the dignity of a woman, you need more than just sanitary towels. Most of the time, sometimes it's distributed in a way that kills the self-esteem of a person. You find that people who are distributing sanitary towels sometimes go to a marketplace and they start dishing it out. And some of the girls are not, it's adolescent period. They have peer pressure. You don't want to be seen going to the market scrambling for sanitary towels that are given publicly. So we have packed it in such a way that shows that we really value the person we are giving it to, regardless of their situation or where they're coming from. When they receive that pack in a very nicely packaged and beautiful way, given with a lot of respect, they feel valued, and therefore their self-esteem comes up. So that's why we are calling it a dignity pack. Our dignity pack is really, really colorful and lovely, and has very, very essential packages for the girl. So in them we have the sanitary towels that they will use. There's enough for them to use for 3 months. And then we give them panties. We also have incidences where you throw sanitary towel at a woman or a girl, and they don't even have panties to enable them wear them with comfort. So we provide panties, some good quality panties for the girls to be able to wear, and we have 2 in this pack. They can interchange. And then we provide soap, which is very essential for hygiene. So we have several pieces of soap in the package. And beyond that, we know that it's nowadays mandatory to wear masks when people are going out to crowded places, and therefore we are providing masks to them as well, so that they are able to wear the masks comfortably and walk out and continue their lives as usual. There are moments when you find some people with either dirty masks, torn masks, or pieces of material that really don't bring out the dignity and respect that the girl needs. So we have made very nice masks for them to be able to use as well. A woman most likely would want to be seen as a clean person who carries herself with a good hygiene and self-esteem. And so with this dignity pack, we are returning dignity back to that girl who had lost it because she could not handle her menstrual hygiene.
This is just a small project, like it's going to run for 3 months. We are basically going to emphasize on empowerment to the girl society. So I would plea or ask the government or any other authorities to take this up and probably extend it from this region to other regions.
3 months is such a short time, but we are living in very uncertain times. We don't know what it will look like after 3 months with the COVID-19 ups and downs. And therefore, but we are hoping that this is something that will have a very positive outcome, and are hoping that other partners may join to help us give dignity back to the girls. It is quite disheartening to see or to hear that a girl has to compromise her dignity to get the basic commodities that she requires for her health. Therefore, we are hoping that this is something that other people can embrace. Our government can embrace it, and other partners who are able to support such a project can embrace it, so that it goes beyond 3 months, and also that we think through how we can bring out policies in our government that enable the girls to access such basic commodities in a way that is easy, affordable, and feasible.
At the end of this project, it is not only Lean on Me that will have achieved, but it's the whole community, the whole country at large.
So I have a very, very strong team here, and my strong team is able to deliver to the community that we want to serve. We want to thank the AIDS Healthcare Foundation for believing in empowering the girls and believing in the work of Lean on Me, and for your support in this project of ensuring that self-care is up in the notch for girls during this COVID-19 season. You too can support us by joining us in this campaign to ensure that our girls are not only safe, but they have dignity. You can reach us in the contacts on the screen, and also through the social media pages that you can see on the screen. Thank you.